with the webinar. So Dr. Cyrena, she is in her final year. Like she is an intern in KMC Manipal. Um, I want her to share her experience and her idea of being doctor and all.
Hi guys, my name is Arina. I'm currently an intern and I'm in like I've completed my MBBS from KMC Manipal, Kasturba Hospital Manipal. So here we'll be discussing about HPV vaccine and its relation to cervical cancer. So looking forward for this webinar. Thank you.
Okay, thank you, Cyrena. Next, our speaker is Uzma. Uzma is a final year MBBS student from ELMCH, Lucknow. Uzma, do you want to share or want to
Yeah,
introduce
sure.
yourself?
Hi.
Yeah.
Hello, everyone. My name is Uzma Tabassum, and I'm currently navigating through the final year of my medical journey at Era Lucknow Medical College. I am very passionate about medicine and also kind of encourage people and mainly women to understand their anatomy and everything and what we can do as a medical students to spread the awareness. And I'm really excited to be here, and thank you so much, Udita, for bringing me here so we can discuss this topic elaborately. And I hope nobody's going to quiz me today. Fingers crossed.
Okay, Uzma. And our last speaker is Jishant. Jishant is also a final year MBBS student from ELMCH, Lucknow. So Jishant, introduce yourself.
Good afternoon, everyone. I am Jishant Singh from Eras Lucknow Medical College. Today, I thank Udita for inviting us for the discussion of this very important topic nowadays. And I'm very privileged to share my thoughts with you all. Thank you.
Yeah, HPV. So let's start with our webinar. So our first question, it will be like questionnaire, like I will ask questions and these three people will answer on on this topic HPV. So what is HPV and why are we discussing this?
See, I would like to answer this question. So we can see HPV as a virus, that cause and viral infection. So the strains of this virus is like more than 100 types of strain we have, and the HPV stands for human papillomavirus. It can cause a different segments of diseases like skin growth to cancers, but it is not necessary that every HPV infection will lead to cancers. But there are different types of genital HPVs that can cause cancer of the cervix. What if I can explain this in very simpler words, that what is cervix? So if we see this as a uterus, as a human uterus, and this is like vagina. So this lower part of the uterus that connects the uterus and the vagina is the cervix. And why I'm giving some this time to explain that what is cervix is, this is the main part where the cervical cancer, which is the topic of the discussion today, takes place. And also the screening depends on the cervix a lot. So further this other types of cancer have also been linked to HPV infections. These includes cancer of the anus, penis, and different parts of the body. Now, how it is spread. So these infections are mostly passed through sexual contacts or through other skin to skin contact. Vaccines are the one thing that can only help against the strains of HPV, most likely to cause genital warts or cervical cancer. The main focus of today's discussion is cervical cancer, which is like HPV can cause almost all types of cervical cancers. But I can say that, for initially when the HPV infection takes place, the symptoms that is going to present in any patient or a person, it will take around 20 years to define ki, yeah, this is like this women or this patient is going towards cervical cancer. So it is very much necessary to understand, or to screen people, to let women understand to take care of themselves, and to have screening regularly. So, like getting vaccinated against HPV infection is the best way to protect against cervical cancer. And further of this will be explained by my colleague. Thank you.
Okay. So, our next question is, we will focus on cervical cancer as Uzma shared about what is HPV and how it leads to cervical cancer and other cancer. So, we are focusing on cervical cancer. And so, how often does this cancer occur?
Yeah, so I like to answer this question.
Okay.
Cervical cancer is a fairly common disease worldwide. A lot of women in India get infected by this virus, and most of them develop the cancer, especially in the areas which have limited access to screening and vaccination. Uh, have more cases of this infection. It is the fourth most common cause of cancer in the women. Every year, more than 6 lakh cases are diagnosed, out of which more than 3 lakhs people die due to this infection. In country like India, where development is where healthcare is not so profound, cervical cancer is one of the leading causes of cancer deaths in adult women. However, in India also, where some better facilities are available, good screening is available, and also some better vaccinations are available, the rates can be reduced significantly.
Okay. I didn't know that this is the fourth most cancer that is spreading in the country. So what are the complaints that the patient presents when they have cervical cancer?
See, this is something I'm going to answer. So there are most what we have to remember out of this webinar is there are like four symptoms that are most important that we have to remember. The first one that any patient I have seen myself in my hospital, that the first any women have always had this complaint of post-coital bleeding, that they have bleeding after having sexual contact with their partners. This is the first symptom that any women will go through. The second is bleeding on straining. Like if they are doing some work which includes some strain to their pelvic region or the abdominal region, they will have bleeding. The third is foul smelling vaginal discharge. They will have vaginal discharge which can be of watery, pink color, or even bloody. And the fourth, or like not that important, but it is although lower back pain, which is related to menstrual cycle, which may or may not related to. And other symptoms can include like pyometria, which means pus in uterus. Lungs can also be involved, like there will be chest pain or there will be cough in blood, some sciatica problem. These are the most important symptoms that we can say that people have who have gone through cervical cancer have. Thank you.
Okay, so these are the main symptoms. Uh, how do you prevent it? Like how we can prevent HPV and then further leading to cervical cancer? Anyway,
Can you repeat again?
it's like how do you prevent it? How do you prevent HPV and cervical cancer, like HPV leading to cervical cancer?
Yeah, so I would like to answer this question. Uh, See, the basic prevention of this disease is mainly with two things. We can do screening, which helps in early detection, and then it is the vaccination.
Okay.
I would like to elaborate on the screening part. So, screening is done for the high risk human papillomavirus, which can cause cervical cancer. Why is the screening important? So, screening is not. Excuse me, I'm sorry for the disturbance. So, why is the screening important? The screening helps in the early detection of the virus. The early detection we can provide the treatment to eliminate the virus, which can stop the formation of the cancer. Or the screening can also help in early detection of the cancer, which can help us give a better treatment. which will lead to a better prognosis for the patient. Now, when should we start the screening? By when I mean at which age? See, uh, ideally we should start the screening at the age of 21. But if we start around 20 or 30 years of age, then it's also good. We should repeat the screening every 5 years normally. Now we will talk about how the screening is done. So the screening, mostly in India, two methods are used for the screening. First is the HPV DNA testing, which is done by taking some cells from the cervix. It is the most sensitive type of test which is currently present in the market. Now, most commonly used test in India is the Pap smear, in which the sample of cervical fluid is collected and test is performed. This test is mostly used because it is way cheaper, and also it can be done easily in routine checkups also. Thank you.
Okay. So routine checkups are there, like we can detect it from there. So next question is, what vaccine is used and how many doses are usually given? What if someone skips or forgets?
Okay, so currently, we have four vaccines for HPV vaccine, like for HPV against HPV. So earlier we used to give Ceravac, which had around 2 to 3 strains for the HPV vaccine. Now currently we have four. So the recent one is Gardasil 9, which is commonly used because it consists of all the strains of HPV vaccine. So it will take care, like it will prevent cervical cancer as well as other diseases which is caused by HPV vaccines like genital warts, plantar warts, palmar warts, etc. So generally the vaccines are depends on the age. So it depends on 2 or 3, depending on the age. The doses are 2 or 3 as per the age. So now the second question you asked was, if we skip the vaccine, what should the person
Consequence.
do? So,
Yeah.
so basically, when someone misses one or two vaccines, the shots of one or two vaccines, so he should continue the vaccine. Uh, in that, there will be delay of the immunity development, but doesn't mean the immunity will not develop. Okay, so the person should when he realizes that he missed the dose, he or she should go to the local doctor, and get vaccinated. Yeah.
Okay. So she need to go and get vaccinated. So vaccination should be done in doses. Like you said, 4 doses are important. So we focused on age. That's why our next question is related to age. At what age is the HPV vaccine recommended? Can a 12-year-old girl get the HPV vaccine? Like you say about it. Like few vaccines are there that is given after 12 years old girl.
Yeah. So basically, the ideal age for getting HPV vaccine is 11 to 12, but we prefer from 9 to 25 years of age. Every woman, it is recommended that every woman should get vaccinated before they are sexually active. Okay, and I told you like about the age factor. So people who are less than 15 years of age, they are given 2 doses of vaccine, HPV vaccination. And people who are more than 15 years, they are given 3 doses of vaccination. And every 6 months, the vaccine, the interval between the two vaccine doses should be around 6 months. Yeah.
Okay, there's a gap on.
And
Yeah.
yeah.
Do you want to share anything
But
else, the panel?
if the person is having HIV, even HIV positive people can also get vaccination. Even people female who had already had HPV vaccine, so they can also get vaccinated.
Like HIV patients.
Yeah,
Like HIV patients.
like HIV patients. Yeah.
Okay. So anyone with questions?
I would like to raise a question.
Yeah.
What are the pre-medical conditions in which we could not take up the HPV vaccines?
So you cannot take vaccines in when a female is pregnant. because
Okay.
it's generally a live vaccine, but nowadays they are preferring for a recombinant vaccine. So if live vaccine is given to a pregnant woman, then what will happen that pregnancy is generally considered to be immunocompromised state. So even a small virus dose in the is if it's injected in female. So what will happen? The viral load, our immune system won't respond that much to the body, and the virus starts replicating so much so that they'll get the disease. Like it doesn't happen normally when the patient is not immunocompromised. Yeah.
Okay, is it safe to take while having a hypertension or diabetes?
Yeah, it doesn't people can take. It doesn't
Oh,
hamper diabetes and hypertension. Yeah.
thank you so much.
I don't
If
think
there is
people are
a
still
type
aware
of
with HP. Anyone?
1 minute, I would ask to like Dr. Sarina that if there is any side effects of that vaccine.
Side effect, yeah. Basically, sometimes what happened, obviously, local irritation will be there. Plus, wheels and discharges can be there at the location of the vaccine. Also, people can have slight fever, irritation, allergies are less, but they can even like if you are talking about very critical conditions, very critical side effects, it can be syncope as well. Syncope is basically people faint because of low BP and all.
Okay, but there is no such like major side effects, no?
No,
Like
no major side effects.
yeah,
It's basic fever, which you even get after
any vaccine.
hepatitis B or any vaccine. Yeah.
Yeah. Thank you, doctor.
I do have a question. Do the panel know how much people are aware about it? Are there any awareness in the society, or still people are lacking awareness regarding HPV?
Actually, there is like very less awareness right now, and we are not even talking about low socio-economic women. You know, the people who comes from a low income backgrounds. We're talking about people who comes from a good family, because in general also we can see that in our country the concern towards women health is very less, so the awareness against this is very less. Even in my family I have recommended this to my mother and my aunts, but they also didn't know about this. So yeah, the awareness is very less, and mostly people, I have seen people talk about breast cancer and all, but things about uh, cervical cancer is not has been discussed this widely. And also what I can say about this vaccine, about this cervical cancer is this is preventable, you know. We can take a vaccine and we can prevent it on the whole. Like it cannot, like I don't think there is another cancer like this that can be prevented, but the good thing about the cervical cancer is it can be prevented. So the awareness against this cervical cancer is very much important. And yeah, the probability or the stats clearly indicate that there is a extremely low percentage of people that know about cervical cancer. And there is, as such, we're talking about HPV vaccine is available, the stats are very low.
So I would ask to like one more question. As Serena mentioned, that 9 to 25 is the perfect age to take vaccine, right? But they recommend after 12. So can people take it after 25?
Yeah, matlab people can take after 25, but basically it's more helpful when people take before they are sexually active, because what happened, the risk factors enlightens, it increases when people take after being sexually active. So that's why it's recommended by the WHO and as well as Indian Medical Council that the vaccine should be given before being sexually active, that is from 9 to 25 years of age.
But who have not taken it before 25 or that,
Yeah,
they can take it.
they can get. Yeah.
Yeah.
Also, one more question I have, You said before sexual active. Okay. So does like menstruation affect it or not? Like if someone who is
No, it
menstruating or
doesn't
not
affect.
mens. Okay.
Generally, the basic idea is that vaccination is given to prevent the cervical, like HPV infection. So, other methods like apart from vaccination, apart from screening, is the general care. That is cleaning the genital area every day, and multiple sexual partners should not be there. Then getting early sexual being early sexually active, and multiple sexual partners with multiple sexual something like that causes more of the cervical cancer. So that's why it's recommended ki before it's very related to the sexually active people. So it's recommended that take vaccine before you are actually sexually active. That's the main concern.
Okay. Okay. Anyone with questions?
Yeah, I would like to ask one more question. It is like out of the topic, but as Serena mentioned, that genital care. So, in market we have available so many type of washes and everything. So, is it safe or to use those things? Like we should use that or not for the vaginal wash and care, whatever they are available. Like V wash and so many other.
Yeah, yeah, you can use that. If
Like,
it's hygienic, if it's clean, if you are changing as per recommendation, it's okay to use. Also,
like
pills are generally avoided because it's not related to cervical cancer at all. It's generally it will alter your hormonal things, so it can lead to infertility and other things which is very common with OCT pills and the hormonal part. Yeah.
so are those like wash or safe to use or like water is enough to clean those area?
What?
Like we have no V wash and other clean
Yeah,
and
yeah.
dry
No, no.
wash.
The
Are those
best thing is to clean with water.
water? Yeah.
Yeah.
Lukewarm water works best for women, you know.
Okay.
Just wash
Hmm.
it with lukewarm water whenever you are like you should not also use any kind of soap or something, because
Okay.
our vagina has acidic conditions which helps to fight out the bacteria that is already present there. So the acidic condition is very very much necessary for the protection. So if you use any kind of soap or something, it just neutralize the acidic condition there. So lukewarm water, wash it with lukewarm water, that is like more than enough. You don't have to use any kind of V wash or something.